My name is Dr. Francisco de Mello. I'm a consultant plastic surgeon and I'm one of the faculty members of the training courses at Vilafortuny Training Center. We are actually having two courses, one on botulinum toxin and another one on soft tissue fillers, both directly to any physician that wants to get some expertise on these techniques. The botulinum toxin covers several aspects of it, not just from the pharmacology and the principles of treatment, but also we're going to cover the anatomy, indications, contraindications, how you do it, and end up in a hands-on treatment, so every participant will have the opportunity to treat one patient and several areas of treatment. On the soft tissue filler course, we have the same sort of layout. We'll be a bit more focused on anatomy, in-depth knowledge of anatomy regarding to fillers. And in that sense, we want you to be able to avoid complications and to have happy patients and really satisfied and great results. So for that, the hands-on will be a very, very important part of our course, but we need to have the foundations in theory, which kind of fillers you need to use. The Vilafortuny course is the only DHA approved and certified course that allows you to add this competence to your privileged scope of practice. The hands-on part of our course is one of the most attractive courses part of the courses in Dubai, because not only will be able to treat a real patient, but we're going through all the stages like in a normal consultation on a clinic. So we're going to cover all those aspects from planning, meeting the patient expectations, selection of the filler or the toxin that you need to be using for this particular treatment, how to handle and how to deliver the treatment in safety, but also how to follow up with your patient and manage the results that are coming. One of the key factors of our courses is we are totally unbiased to any commercial brand, so we are free to discuss everything. Book your space today and visit us through vilafortuny.com or through our social media, but do it fast as the vacancies are running out. Thank you.